CoapTech is proud to introduce the Puma medical device system for safer, simpler, and faster bedside procedures. Our patent-pending platform technology will be utilized initially to disrupt the market for enteral nutrition feeding tubes. Millions of patients around the world utilize feeding tubes, including hospital patients, cancer and diabetes patients at home, and preterm infants in the developing world. The Puma system will simplify the procedure for feeding tube placement, offering a safer, more affordable method. The currently used procedure for placing enteral feeding tubes is known as the PEG, or percutaneous endoscopic gastrostomy method. This approach is most often performed in a specialty suite by a highly skilled surgeon using an expensive endoscope. The endoscope is first placed down a patient's esophagus and the stomach is inflated. The endoscope is then illuminated to reveal the placement site, and a serial dilation is performed until a feeding tube is then placed. However, this procedure does not visualize space in between the stomach and the skin, and thus poses the risk of puncturing organs or harming vasculature, which can cause emergency complications or even death. CoapTech's approach can be performed by a non-surgical provider at the patient's bedside. Our solution uses a patented combination of magnetism and ultrasound technology to visualize this space. Rather than an expensive endoscope that must be cleaned after each procedure, the sterile and disposable Puma balloon is placed in the stomach via the esophagus. Externally, a palm-sized ferromagnet is used to attract a small bar magnet inside the Puma balloon. Once the magnets have engaged, coaptation is achieved. The balloon is filled with colored, echogenic fluid. Point-of-care ultrasound is then easily able to visualize the entire space from skin to stomach, revealing any intervening organs or vasculature. The Puma balloon is easily controllable from the outside, and the user can search for a safe site that can be used for successful feeding tube placement. Once the site is identified, the provider can safely puncture the skin and form the gastrostomy tract. A guide wire is inserted and the feeding tube is easily placed over top using the Seldinger technique. The CoapTech solution is not only safer, it is also significantly less expensive. The conventional PEG is most often placed in the endoscopy suite and has device costs around $250, plus cost for the endoscopy suite time, which is substantial. There are also transport costs, cost for the specialists involved in the procedure, cost for the endoscope which is used, and cost for medications. There are also significant indirect costs using the conventional PEG method, as patients often sit waiting in expensive hospital rooms for multiple days, while the endoscopic procedure is coordinated among multiple team members. The CoapTech procedure will cost significantly less than the conventional PEG, and so we can charge a premium for our device. The CoapTech procedure is performed at the patient's bedside, and thus eliminates the trip to the endoscopy suite and all of its required inputs. CoapTech is introducing a safer, more affordable way to place feeding tubes, and this is only the beginning.